What a great facility, right? I only wish America took care of its servicemen the way Singapore does. That would be nice. So I'm Dr. Zach LeBeau. I'm an American chiropractor. I am new again to Singapore. I was living here prior to COVID, and then had the misfortune of getting stuck in Bali during COVID, which was awful. And then had to return to the US because my EP expired. So I just returned a month ago. I'm glad to be back. Thank you for having me. I enjoy your city very much. It can be a bit of a grind sometimes, but as far as urban living goes, I think it's arguably one of the best in the world here. So you're doing very well. All right, so let's dive in. We're going to talk about taking back your health, and that starts with, I'll tell you a little bit about chiropractic. Does anybody know much about chiropractic? Does anybody watch the YouTube videos with all the popping and the cracking? You've seen some of those? No? Okay, there's a bit more to it than that. We are, if you want to flip to me, yeah. We are doctors of the spine and the nervous system. The nerves that exit the spinal column, they communicate with every muscle in your body, every organ system in your body. So through chiropractic care, what we want to do is we want to restore normal neurological function, which in turn restores normal muscle tone, normal visceral function, and just makes you healthier and better. And speaking of Singapore, let me ask you a question. What does chiropractic and Singapore have in common? Does anybody want to have a go at it? Anybody want to take a crack at it? I worked on the joke all night. Okay. Let me tell you, so if traditional Chinese medicine is here, right, and Western allopathic or diagnostic medicine is here, where does Singapore fit in? Kind of right in the middle, right? I mean, you go both ways. Same could be said for chiropractic. So what we did is we took the art of Chinese spinal manipulation, they call it Tui Na, and we combined that art with a lot of Western diagnostic tools like X-ray, MRI imaging, a very precise knowledge of the anatomy to form the science of chiropractic, and that's what we do. And so you're going to see this repeated over and over again throughout the presentation, is proactiveness equals productivity. And Singaporeans, we're all very productive here. Pretty sure I'm certain on that. Okay, so these are the conditions that I see on a daily basis that should be of concern or interest to you at the very least. Headaches, migraines, some of you might be experiencing some of these symptoms right now. Vertigo, and that can come from a variety of things, not just spinal issues, but if you are experiencing things like vertigo, get your eyes checked, get your ears checked. That'd be a place to start, and come to the chiropractor as well. Neck pain, upper back pain, low back pain, neurological conditions such as numbness or tingling in the hands and feet. If you are experiencing that, that's a symptom that you're going to want to have taken care of and get looked at. That's kind of an advanced system because your nervous system is very involved in when you're experiencing that numbness and tingling, the nerves are already on edge. They're already aggravated. And so what causes these? Micro trauma or repetitive use trauma. And we're going to talk about that a little bit later, okay? We're going to readdress that. So when it comes to the nervous system, are you content with 3G or do you want 5G? I mean, do you want a speedy connection from your brain to your hands and your feet and to all your motor skills? Or are you content with just running in slow motion? Now, what is the role of the nervous system? The nervous system is omnipresent. It's present in every single thing you do, even when you sleep. So obviously, communication, coordination, sensory information, motor function, response, decision-making skills and control, learning and memory, all these things. One example is if maybe some of you have elderly parents and you're concerned about their mental health maybe deteriorating a little bit, something great for them would be give them a musical instrument, because a musical instrument encompasses so many different neurological pathways, both auditory, both visual, fine motor skills, and it really keeps the brain young and sharp. There's a process called dendritic growth, and when you learn new things, these dendrites have to grow. And so for older people that might be stuck in their room just clicking channels, if you can get them to learn an instrument or even like Sudoku, things like that, that keeps the brain young and sharp. So if you are content with 3G, you might be experiencing some of these problems. And this is kind of the feedback loop of this what I mentioned earlier, which is the repetitive use trauma, which is that sitting at the desk all day. So the first stage is aggravation. Your nerves become aggravated. That causes inflammation. Inflammation then causes pain. And that pain, that inflammation, that's the interference within the nervous system that slows everything down. So that takes your 5G down to a 4G, down to a 3G, and you're just not functioning properly, okay? And again, proactiveness equals productivity. If you address these things before you experiencing even the aggravation, you have a look at these things, and we do that through X-ray. We can be more proactive, and it's going to be a much easier process to fix. Okay, this is kind of the bummer, the depressing part of the presentation, but it needs to be addressed. What is chronic pain? Chronic pain is a long-lasting discomfort persisting for 3 months or more, often resistant to treatment. It can be caused by conditions like arthritis, fibromyalgia, or due to prolonged strain, such as spending long hours working at a computer. This prolonged computer work can lead to chronic conditions like carpal tunnel syndrome or chronic pain, significantly impacting a person's quality of life. So this is what we want to avoid. And if you had some nagging conditions, it's time to get them checked out. I always say to all my patients, pain does not have to be a byproduct of aging. You know, just because you're getting older, you don't need to say, man, I'm getting older, what a bummer, I guess I just have to deal with this pain. You don't have to. You don't have to live that way. There are ways and things that we can do to remedy that, to fix that. Again, proactiveness equals productivity. So a little bit more about chronic pain. The rule of thumb in regard to chronic pain, and all chiropractors will tell you this, is that the longer it's been hurting, the longer it will take to fix. So that's why you want to address it early. That's why you want to be proactive. Consequences of chronic pain are, it hurts. Pretty obvious stuff. Loss of productivity, anxiety and stress, depression, and an overall negative effect on your mental health. And this is, the opiate drug use for pain is, in my experience, it's opiate drugs actually reward pain. And that's why they're so addictive. And this is a very epidemic problem in the United States. So what I did was, I'm going to tell you a quick little story. I'm from a small town in the Midwest. And there was, about 10 years ago, we had a really good athlete come out of that town. And he played football at the University of Missouri, which is a big SEC school. Like 70,000 people go to these college football games. And he was a big deal in town. He goes off to college. His freshman year, he blows out his knee. His doctor prescribes him 40 hydrocodone, which are very strong opiates. And this is a 19-year-old kid. Within 6 months, not only did he lose his scholarship, but he's in and out of prison because of his addiction and trying to maintain these pills that he no longer has access to because he can no longer get the prescription. So, and this is seen over and over and over again. There's a book called Dope Sick, which kind of chronicles the abuse of opiates in the United States. There are a couple Netflix documentaries about it. It's a very serious problem. So what I did was, just relating to the kid that came from my hometown, I asked AI, Dr. AI, what the percentage is of people that get addicted as a result of injury, and this is what it told me. And keep in mind, this is AI. It doesn't have any concern about your health whatsoever, but this is what it told me. It said, I'm sorry, but I don't have the specific data or percentage of college athletes who become addicted to opiate drugs after being prescribed by a physician following an injury. It's important to note that misuse of prescription opiates can lead to addiction, and this risk exists for anyone taking these medications, not just athletes. It's a significant public health issue that medical professionals, policymakers, and educators are working to address. So that's AI talking. That's not even anyone with compassion. So it's very important not to get addicted to these, but don't even start. Again, proactiveness equals productivity. So before you get to a condition like this, come see us and see what we can do for you. Okay, and these are all contributing factors to chronic pain. Now you'll notice that the top two, injury or trauma, some of these we can't control. Maybe you get banged up in a car accident. We can't control that. You might need surgery for that. Disease processes such as autoimmune disease. Now, if any of you have any history of autoimmune disease in your family, especially women, you should get that checked out. There's a blood test you can have that tests for what's called RA factor. That can tell you if you're predisposed to developing autoimmune disease. So again, proactiveness equals productivity. And then here we are, we're back to the micro trauma and repetitive use trauma. So again, these postures here, I mean, that's the ideal biomechanics of the spine right there. And this is what it looks like when you got your head down on your phone. So you take the normal weight of your head, which is 4 to 5 kg. When you add that by this angle here, physics tells you that it's 60 pounds, which is 10 kg-ish? Yeah. No. Yeah, 6 kg. 2.2 pounds, 60? Yeah, 30 kg. Okay, ish. All right, let's move on. We're going to talk about microtrauma now. So microtrauma, also known as repetitive strain injury, is a condition resulting from placing too much stress on the same body part over a long period of time. Over time, these tiny, almost imperceptible injuries. So when you sit down at your laptop, you may have posture in mind, and that's going to last 5 minutes, maybe 10, and then the next thing you know, you're like this. So it's hard to maintain that posture throughout the course of a whole day. These things, over time, these almost tiny imperceptible injuries can accumulate, leading to inflammation, pain, potentially the loss of function in the affected area. It's common among individuals who perform repetitive tasks, like musicians, factory workers, and those who do what? Work at the computer for long hours, and then get on the MRT and do like this for another hour, and then probably go home and get back on the screen. So all this is, these things are repetitive use, and then they do take its toll. It's not like getting banged up in a car accident all at once, but over years of this kind of behavior, it can have the same effect. Okay, so structural problems caused by repetitive use trauma. The pain is only a symptom, and pain is actually an advanced symptom. Pain is your body saying, hey, I'm trying to work here. There's things you got to do for me in order for me to function properly. So even before pain, there are structural issues that are causing that pain. Pain is a response to structural issues from improper biomechanics. We're going to talk about that right now. Improper biomechanics lead to deterioration of the soft tissue within our joints. This deterioration of the soft tissue leads to arthritis, which leads to inflammation. Now, in regard to biomechanics, let me ask a question here. You don't have to raise hands, but if you're under the age of 35, pay attention to this. Or if you have young children that are in the process or getting ready to go through their growth spurts. Now, I've been doing chiropractic for about 20 years, and when I started, if I had a person in their late 20s, even early 30s, they would come in, it was always acute conditions, they never had anything chronic going on, maybe sometimes if they worked with their back or, digging ditches and things like that. But those injuries were very easy to heal, and sometimes I often didn't even ask for x-rays because I knew I was going to find just a normal spine that's had some strain or stress from an accident or an injury. Today it's entirely different. I mean, the x-rays that I see of 28, 29, 30-year-olds today are extraordinary, like night and day different than the ones I saw 20 years ago. I mean, if I was to look at an x-ray and not see the age, I might guess that the patient is 59 rather than 29. And why is that? What do you think is the cause? That what happened in the last 15 to 20 years that would change the x-rays, the structural condition of young people so much in such a short period of time? It would be this repetitive use trauma of looking in that phone. And when a child goes through their growth spurt, the spine is not meant to grow rapidly in the shape of a 7. And when it does, it takes all the proper biomechanics out of the spine. So typically, if you have the right curves to the spine, your head should sit very comfortably right here on top of your neck. But when it's pitched forward right like this, all that stress gets put on these posterior elements of the neck, the ligaments, the muscles back here. That can lead to headaches, it can lead to neck pain. But what's more concerning is it puts additional stress on the medial part here. And so these discs begin to wear down because of all this additional stress. And you get what's called bone on bone. And when that bone on bone rubs together, that is the beginning of arthritis. So I'm starting to see ugly bone on bone conditions with very young people now. And it's causing neck pain, it's causing problems. Now, the good news is that they are young and they'll respond to care, so we can fix them. If you wait till you're in your 40s, it's going to be more difficult to fix those conditions. So remember, proactivity equals productivity. Yeah. Okay, and again, all these cause inflammation, and this is what we're going to address next, is the inflammatory process, which is enemy number one of the human body. There are foods you can eat that are anti-inflammatory. There are many things you can do to keep this inflammation out of your body, but specifically today we're going to talk about that repetitive use trauma and how to avoid that. So what is the pain inflammation feedback loop? Inflammation causes pain. Pain then causes more inflammation, which results in more pain, which in turn causes more inflammation, which results in more pain, leading to more inflammation, resulting in even more pain, resulting in what? A really long day at the office and a terrible night of sleep. So you take that home, you take home all that inflammation, and your spouse is the next one to hear about it, your kids are the next one to hear about it. You don't sleep well at night because of all of this. You come to work the next day unrested. Your wife's mad, your husband's mad, the kids are having a lousy day at school. It's all encompassing, and it's just, and it can be avoided. That's the thing I want you to remember, that it can be avoided with proactivity. Okay, so how do we break the cycle? And this is the part about taking back your life, and this is the role of chiropractic. And there are a lot of things that we can do. We'll address that, but we're going to start with chiropractic because that's what the talk is essentially about today. So, to fix you structurally, restoring proper biomechanics within each and every individual joint of your spine so that it can function the way it's designed to do. We are merely facilitators of your own natural healing capabilities. We simply restore what is already meant to be. And that restore is a key word. We're not changing anything. We're not reinventing the wheel. We're just restoring your posture to the way it's supposed to be so it can function properly with proper biomechanics. Those biomechanics are so important. When you take the proper biomechanics out of a joint, it's just not going to be healthy. Joints nourish themselves through motion, they lubricate themselves through motion, and so if they don't have that motion, they're going to be unhealthy and they're going to deteriorate, and again, that's when the arthritic process sets in. So proactivity equals productivity. Now, what does Deepak Chopra say? The body is a self-healing organism, so it's really about clearing things out of the way so that it can heal itself. And that's what we do as chiropractors. We remove that interference in the spine so you can take your 3G connection and take that up to 5G, be more productive, be happier, the husband's happier, the wife's happier, the kids are happier, everybody's happy. All right, so let's take our 3G and make it 5G. Okay, and so some of the shared goals of chiropractic. Goal number one is to get you out of pain. All right, and we want to do that as quickly as possible because pain is miserable, nobody wants it. So that is absolutely goal number one. As quickly as possible, we want to get you out of pain. But then we want to identify where that pain is coming from. And that's the critical role, that's the critical part, because if we just fix the pain without addressing where it's coming from, what's going to happen? I mean, it's obvious, it's going to come back, right? Because unless you're ready to retire anytime soon, which I'm not, it's going to come back. So we identify the cause of your pain, and we do that through diagnostics, typically x-ray. MRIs are also very good, but with an MRI you're laying down. Most chiropractors like to see an x-ray of the spine while you're standing up to see what the biomechanics are and where those proper curves are, okay? So at that point, we want to fix you structurally, thus restoring proper biomechanics to the spine. And then once we restore those proper biomechanics, we want to maintain that with wellness care. All right? Now, how do we do this? I mean, how do we take, a spine that's doing this every day and restore that normal curve to the neck? So, for example, I wish I had my dry spine, so I could show you, like I said, the curve to the neck is kind of like this, so your head sits right here. What we're seeing a lot is there's no curvature to that neck whatsoever. It's like this. And when you remove those proper front to back curves in the neck, sometimes what we're also seeing a higher incidence of is scoliosis. So if the spine doesn't have the proper front to back curves, so curve here, kyphotic curve here, and lordotic curve here, if it doesn't have those proper curves, it can become confused and it can start to grow sideways. And that's what scoliosis is. And we're seeing a much higher incidence of scoliosis these days, especially in young people below the age of 30, than we ever have. And it's because the spine does not have those proper curvature to it. So how do we fix that? We fix that through the chiropractic adjustment. So with the chiropractic adjustment, we're simply adding motion to a certain segment of the spine. But it's very specific motion. You can go to a Thai massage therapist and get your back cracked, which I do sometimes, which is good until it's not, you know, and until they hurt you. But that's fine. But with chiropractic, with our diagnostic tools like X-ray, we want to be very specific with the direction and the vectors that we move these segments of the spine. But with everything, with every single joint in the spine, we want to add motion to it, because what did I say earlier? A healthy joint is a joint that has a lot of motion to it. So add motion to the spine via the chiropractic adjustment, but it's more than just motion, it's alignment. So we want to add that proper alignment, which restores proper biomechanics. And then, so the adjustment is what we do in the office, so that's why you come see us. We do the adjustments in the office, but then you have some homework to do. So we give you some tools that you use at home. One is a pillow, for example, that restores curve to the neck. The curve to the neck, you know, you might be experiencing low back pain, but that potentially could be a result of you know, the biomechanics in your neck. And that's one thing I always look at is with every single patient in Singapore, I want to see a lateral x-ray of their spine to see what that curvature looks like. And if it looks like this, if it's bent forward, that's a problem. If it's not a problem now, it's going to be in the future. So that's priority number one. And when I worked in Jakarta, I worked with, it was a scoliosis practice. I worked with scoliosis kids every day. And here's the interesting thing. A lot of, there are some theories that say you have to address the curves in the spine to fix the scoliosis, which you do. But what you really have to do is restore that normal curvature to the neck and focus on that. Still want to work on you know, affecting the curves. But once you restore that normal curvature to the neck, especially the spine of a young person, innately straightens out. Just does it on its own. The spine has this wise, you know, just innate capacity to, once you restore the proper front to back curves, the rest of the spine just straightens out. And so if you're in your, you know, late 20s or early 30s and you have some of that scoliosis, we can effectively treat that. Not as well as we could, you know, a child, you know, 15, 16-year-old, but we can certainly affect that treatment. If you're in your 40s and 50s and you have some scoliosis, what we can do is we can manage it so it doesn't lead to pain in the future. And scoliosis isn't always a pain generator, especially in young people. It will be later in life, but it may not be now. So that's the importance of our spinal screenings, which we're going to do a little bit today when we're done. Is, you know, and if you do, so what the screening does is it detects heat and inflammation. So if you have some of that heat and inflammation, we're looking at, you know, potential problems. Could we go back one slide? I think, yeah. Okay, so yes, so in regard to reshaping, so we add motion to the spine, but then by reshaping it, we give you, there's, especially in the neck, there's a little pillow that we give you. You lay on it for maybe 5 minutes every night, and the way I do it, my nightly routine is this. I grab my little pillow, I lay on my back, and so it's restoring that shape to my neck. I send out my last couple text messages, and then I put the phone aside, and honestly, in 5 minutes, I really feel like it took a lot of the stress of my day and just made it disappear. It really, it's a good tool to have. Helps me sleep because it also kind of, you know, slows down a little bit of that blood supply to your head while you're laying on that, so it kind of wears you out. But 5 minutes is all you need to remove all that stress from your day. Okay, synergy. The journey of 1,000 miles begins with a single step. So the hardest part could be making that phone call. But we're here now, do the spinal screening, fill out the form, that's your first step. And that's, you know, who knows where that can lead. You know, it might lead to, you know, you come into the office, you start to feel better, that gets you into the gym. You know, once you're in the gym, you start looking around, you see everybody in better shape than you, that leads to a better diet, you start eating better, and so on and so forth. So it's, again, it's instead of a feed backwards loop like pain inflammation, it's a feed forward loop, and you're just getting better and better and better. And what does that equal? That equals total health. Okay? So, let's talk about the scan. Where you want to flip to? Does anyone have any questions? I feel like I kind of rattled through that a little too quickly. All right. If there aren't any questions, I'll go ahead and explain what you're going to see in your scan. You're allowed to talk, and you can ask me. Yeah, just direct it to me if you have questions. I'd be happy to discuss. No? Okay, so when you get your scan, you might see some of these colors pop up. Green is good. Green means there's no signs of inflammation. Doesn't mean it's not a good idea to, you know, maybe come and get an X-ray of your spine just to see what it looks like. But if you get into the orange and into the red, those are higher symptoms of inflammation, and you might be the ones experiencing neck pain, back pain, headaches, things like that. So Henry here and the staff will help you out with the screenings. And I think am I to introduce the drawing or?
Sorry?
Okay. I think
Oh, no.
Okay.
Yeah.
Okay, well, thank you for your time. I appreciate it. And yeah, I'll be here for the rest of the day. If you have any questions, I'd be happy to help or answer them. Okay? Thank you.